Hi, I'm Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health at Sheshadripuram, Bangalore. I'm also the Director and Co-founder of Aveksha, which is a home-based primary care program at PCMH Restore Health. My expertise is in palliative care and geriatric care. We provide home-based services for those who are in need of it. So, coronavirus, like the name says, is a virus which is transmitted from animals to the humans, and it is not normally found in humans, and it causes mainly the respiratory infection, which is like cough, cold, fever, and it can develop into a pneumonia, or person can later end up with a multiple organ failure if not managed in the initial stage. So as of now, there is no definite medicine as such available for treatment of coronavirus, but it is mainly the supportive care and the symptom management. That is, if there is fever, cough and cold, those should be managed as any other cough and cold and fever. But if somebody develops breathlessness or a cough which is not subsiding and fever which is not coming down in a 2-3 days of time, a high grade fever, and causing other problems, then they should seek immediate medical care and first report to their family physician. Call your family physician to ask further details in case you have a cough and cold. But as of now, there's no tablet which is available for treatment of coronavirus. So it is mainly prevention by washing your hands regularly, frequently, or using an alcohol-based sanitizer, what is available in the market. Do not touch surfaces which can be carrying the virus, because when somebody has a cough and cold and they try to touch any object, they transmit that infection to that object. It could be a table, could be the knob, the handle of the door, phone, any object which is touched by a person. So you need not sanitize all these products, but avoid as much as possible touching surfaces, touching objects which are not required. And if you happen to touch anything, please wash your hands properly with soap and water or with the sanitizer before you touch anything else. Do not touch your face, eyes, mouth with your hands frequently. Avoid touching your face, because that's how the virus gets transmitted. And also to drink enough of fluids. If you have fever, cough, cold, or even otherwise, drink a lot of water, eat a lot of fresh fruits and vegetables, which give you more immunity to fight these viruses. So prevention is the best cure.